A very good morning. I, Dr. Sri Gauri, oral maxillofacial surgeon and implantologist, faculty of the Global Dental Academy, take immense pleasure in welcoming you all on a wonderful Sunday morning from the garden city of Bengaluru to this wonderful and exciting webinar series called the Next Level Learning Webinar Series, brought to you by the Global Dental Academy. Experience is the only source of true knowledge and is the most powerful weapon which can be used to change the world. An investment in knowledge pays the best interest. And we at Global Dental Academy are committed to bringing in the best of the minds of the world on this platform. I would now like to invite Mrs. Anita Niranjan, Managing Director of Global Healthcare Academy, to give us a formal welcome address. Mrs. Anita Niranjan is a wonderful person and a taskmaster who steers strategic as well as operational initiatives of the Academy. She always puts the team together in providing holistic, inclusive and solution-centric approach to challenge the identification and resolution by tech-enabled management. She has profound understanding of the healthcare education and challenges so that a win-win approach can be brought about to bridge the academia industry divide through the best in-class scholastic programs that complement the university curricula. Over to you, ma'am.
Good morning, everybody. I'm very happy to be here among all of you on a Sunday morning. I'm sure it's going to be a very enriching Sunday morning with Dr. Girish Rao and Dr. Anand Krishnan, who's going to deep dive into dentistry and much more. I'm Anita Niranjan and I head Global Healthcare Academy, which is an institute with a mission to develop competent and compassionate human resources for the healthcare sector. GHA also promotes innovative solutions and enterprise in healthcare. Our core purpose is to bridge the skill and knowledge gap between formal education and needs of the healthcare industry. GHA, we have focused verticals in skill development, upskilling, paramedical and nursing. We have continued medical education for doctors and other healthcare professionals. We also promote select university courses for their innovativeness and employability potential. We have a journal wing and also a conference division. The distinguishing features of GHA training include intense collaboration at every stage between practitioners and tutors, from conception and formulation of training programs, enlisting of faculties with sufficient work experience, case-based learning with real-life solutions, and practice-oriented learning methodologies. GHA is led, managed, and advised by reputed doctors and healthcare professionals. Our chairman, Dr. Ajay Kumar, always says learning is a continuous process and also needs to be rapid and dynamic in healthcare if we have to service mankind effectively and efficiently. In this journey, having known the highly reputed and successful maxillofacial surgeons Dr. Girish Rao and Dr. Anand Krishna, it was quite but natural to launch Global Dental Academy. We are sure with their leadership, we will surely be impactful in dental education. GDA, which is the short form of Global Dental Academy, provides you with actionable information and insights in physiologic based dentistry aimed at enhancing your professional flair towards ensuring the wellness and well-being of your patients. GDA has made physiology relevant to life with logical and scientific information about path-breaking care and cure in dentistry. Our continuing education programs achieve a seamless blend of comprehensive diagnosis, contemporary techniques, and cutting edge technology. They help you become a complete mouth doctor aimed with the ability and agility to provide holistic oral health, including teeth, bones, muscles, and joints. At GHA and GDA, we are committed to experiential learning using the best of today's technology, be it the learning management system, augmented reality, or virtual reality. My next speaker, Arvind, who is the CEO of Actually, will actually take you through how, virtual reality and augmented reality is taking us to the next level learning in every aspect of healthcare education. Virtual reality is a technology emerging as a powerful tool in medical training and has been proven by multiple studies to be 500% more effective in training and skill mastery. Simulation has long been a valuable method in medical education as it involves techniques that imitate pre-hospital patient situations and facilities learning and development of psychomotor skills to demonstrate procedural skills, decision making, and critical thinking without affecting the patient. GHA plans to deliver these immersive VR training courses to more than 20,000 healthcare professionals globally in this year, 2022. This will be one of the largest development of VR-based training in the world. We invite each one of you to visit our website, go through in detail of all the programs specifically in dentistry, be it implantology and and dentistry for medically compromised patients, medical emergencies in dentistry. We look forward for your participation on each of these programs and take benefit of what we have envisioned to do in this healthcare sector. Thank you, each one of you, for joining us here today. And now I will allow the team to proceed with the next part of the program. Thank you so much.
Thank you, ma'am. Thank you very much. Virtual reality is the first step in a grand adventure into the escape of imagination. Virtual reality is really a new communication platform. By feeling truly present, you can share unbound spaces and experiences with the people of your life. Imagine sharing not just moments with your friends online, but the entire experience and adventure. This exciting world of virtual reality and augmented reality which was the word of every gamer, is now the word of every healthcare professional, be it in the field of education or clinical practice. To talk about this exciting new technology, we have with us Mr. Arvind Upadhyaya, the founder and CEO of HLE Inc. They are here to bringing in a culture of innovation. They have some of the best minds in the industry working with the vision to reimagine reality. Entrepreneurs, investors, inventors, engineers, designers, and hackers who are constantly pushing the boundaries of what's possible. They have them all. Over to you, Mr. Arvind Upadhyaya.
Hi, I'm Arvind Upadhyaya, founder and CEO of 8Chili. Today, I want to talk to all of you about virtual reality and its effectiveness in hands-on training. So to give you a quick intro about myself, I'm a two-time founder in my previous startup. We developed augmented reality-based preoperative planning for neurosurgeons. And now we have, in HLE, our focus is to deliver, hands-on training, and bringing reality to the virtual world by a concept what we call as virtual teleportation, wherein a trainee or a user can experience the procedure or the intervention or the task which is performed by an expert and imitate their actions and learn by it. Let me try and share my screen. So the pandemic definitely has accelerated the adoption of virtual reality training across the world. Especially, we see that most of the leading institutions like Stanford, University of Arizona, Oxford, Cambridge, the Royal College of Surgeons, some of the big players have endorsed virtual reality training and they've adopted it in their curriculum. The reason why they're doing that is we already have a shortage of skilled professional, and we have very less hands-on training. In spite of even with or without COVID, there are a lot of duty hour restrictions. People are unable to put in the number of hours that is required for them to excel or gain skill mastery. The intention is to use virtual reality to bridge this skill gap and make available skilled professionals, be it doctors, nurses, paramedics, and in this case especially like dentists and implantologists and oral and maxillofacial surgeons across the world, and increasing their number and making them skilled. So the goal is to level up your skills in the metaverse. And everyone talks about the metaverse, but actually has a very unique proposition. We are bringing a first of its kind hands-on training in a fully immersive 3D environment. Wherein you get to see the actual surgeon performing the procedure or the intervention. And we provide you virtual tools and haptic feedback to imitate and learn from the surgeon's actions. Right. What you see here on the screen is, two pairs of hands. One is the surgeon performing the actual intervention or procedure, and then the student who's put on the virtual reality headset, now being able to imitate the surgeon's actions by overlaying their hands with virtual tools, and thus gaining the required skill set. And here, but we have definitely captured more than 200 hours of procedures in the last 3 to 6 months with eminent surgeons like Dr. Girish Rao, who's helped us capture some of the most complex procedures to some of the procedures that are the procedures or interventions that are done on a day-to-day basis. So this is a case of a mandible reconstruction of a patient, but as you can see, before the actual procedure, the CBCT scans, the 3D scans of the patient patients are analyzed and diagnosed, and the plan is kind of like perfected in virtual reality. So this is the 3D reconstruction of the patient scan. When you're learning, in our learning modules, you're taken through this virtual planning piece as well, wherein you get to interact with the complete 3D organ anatomy, as per the, from the patient scans itself. And then you get to imitate the surgeon's actions with all the virtual tools that I used, be it, surgical dental drill bit or any other dental tools that are being used. So what you see here is actual colors, true colors, the way the tissue looks, the way the bone is going to look, the way the the implant is being placed and drilled. So you get a very unique experience of being Dr. Girish's eyes and hands, and being able to perform and practice like him. So it gives you a leg up, because what your brain is doing while you are practicing in this manner, is your brain is kind of like telling you that you've been there, you've done that, and this is experiential training wherein you're imitating the expert's actions. So it gives you the fully immersed training, and helps you relive that specific moment again in time. Going to the platform, and how virtual reality is effective. There are a bunch of studies that we have conducted with our collaborators here at University of Arizona, West Virginia, and Stanford, that provides that VR training using our platform is very, very effective. And it increases your time to acquire a specific skill set, or it speeds up. It speeds that skill acquisition by almost 500 to 600%. So if something would take you like 5 days, it will now take you probably less than a day to master that skill. And I just want to say that in the healthcare space, it's very important. We as a company understand how important hands-on training is, and that's exactly what we deliver. Instead of a gamified experience, we bring you into the real world experience itself, that is not available on any other platform. So it's a first of its kind launch in India with our strategic partner, Global Dental Academy. And I'm very excited to share, oh, right. As you saw, you are able to experience and train by imitating the expert's actions. This brings you closer to reality, rather than having a gamified experience wherein you are looking at animated objects, and when you actually go into the real world doesn't mimic the scenes, what you have seen or what you have worked in the virtual world. We are bridging that gap. So we kind of provide you virtual teleportation to a task or a surgery or an intervention, and then we get you fully immersed to relive that specific moment again in time. This is highly effective. When training on our platform, you are able to increase your effectiveness of skill mastery by up to 500%. So whatever was taking you 5 days earlier would now take you less than a day. And more importantly, when you go and when you are actually facing that real life scenario, your mind is going to tell you that you've been there, you've done that, you've practiced with an expert healthcare professional or a surgeon, and now you can do it as well. So it's the confidence that we also build along with the nuances of the procedure and the tasks that we are able to provide you in virtual reality. Most importantly, as a company, we believe that hands-on training is critical for skill mastery in healthcare, and we go by the motto that we want you to move your hands and get that feedback visual, like annotated, like audio, and then of course haptic, like all of this combined to help you remember and implement whatever you learn in this virtual world. I'm very happy to announce that it's the first time that we are bringing a solution like this to India through our strategic partner, Global Dental Academy. And I really want to thank Anita and Dr. Girish in giving us the opportunity to VRize some of the amazing content and bring it to life, for students and trainees and professionals across the world. Thank you so much. You can always reach out to me personally using my LinkedIn handle, or you can write to us, at Global Dental Academy, and we're always happy to answer any of your questions. Thank you.
Thank you very much, Mr. Arvind Upadhyaya, for such an insightful information about the virtual reality and HLE. I now invite Dr. Girish Rao, my mentor and guru, an excellent clinician and a passionate teacher, to give us an insight on today's main topic of the webinar, of the implantology to the next level learning webinar, which is sinus lift in a day-to-day practice. Dr. Girish Rao completed his undergraduation from Government Dental College, Bangalore, and post-graduation from Government Dental College, Madras. He was trained in UK for a decade in all aspects of facial-maxillary surgery and secured 2 fellowships from the Royal College of Surgeons of England and Ireland and an honorary fellowship from the Royal College of Surgeons, Edinburgh. With 32 years of vast experience as a maxillofacial surgeon, implantologist, clinician, and a teacher, he always believes in the mantra of knowledge shared is knowledge gained. He is a visionary and is always excited to bring in innovation and technology into the practice and learning. He is one of the leaders in implantology of the world in our generation. He is the president of the South Asian Society of Oral and Maxillofacial Implantology, founder, director of the Implant Study Group and Global Dental Academy, as well as My Dental Plan Healthcare. Dr. Girish Rao is currently the Honorary Secretary of the Association of Oral and Maxillofacial Surgery of India. He is now going to talk to us about sinus lift in day-to-day practice. Over to you, sir.
Very good morning to all of you. Thank you, Gauri, for those very kind words of introduction. It gives me immense pleasure to invite you for the first Next Level Learning webinar series, which we have started from Global Dental Academy. Both myself and Dr. Anand Krishna have been training a lot of people on implant dentistry over the last 2 decades. And during the COVID time, we felt that there is a need to change the way in which we are basically doing our training programs. Education has completely changed during the COVID times, and a lot of programs have been done online. And we were looking at how we could take this training experience to the next level. And that's where, when we came across Global Healthcare Academy, and thanks to Dr. Ajay Kumar and Mrs. Anita, who coaxed us to basically join together so that we can actually take the learning experience to the next level. And that's where we are introducing a lot of our training programs through virtual reality, augmented reality, and use of haptics. And that's where Global Dental Academy is going to be probably the first in the world to actually incorporate training in the virtual reality space. And that's going to make a huge, huge difference for your training experience. So in this today's program, we thought we will discuss with you on how you can incorporate sinus lift procedure in your day-to-day implant practice. I know you've all been doing an excellent job in implants, and as clinicians, we always hope and pray that we get an excellent, ideal kind of scenario. This rarely happens. Most of the times, we have patients coming in with medical problems. We have patients who have compromised bones. It could be compromised in terms of volume, or it could be in terms of the quality of bone which you have. And that's where you have to have an skill which will take your implant practice to the next level. Especially in the posterior region of the maxilla, the sinus is there, and we know that the moment the tooth is taken out, nearly around 30 to 40% of the bone is lost in the first few months itself. And if it's not restored with an implant, we tend to have what's called as the hyperinvagination of the maxillary sinus, which erodes the bone from the top, as well as there is a resorption from the bottom side, that's the oral side. And that's where you have a very, very compromised kind of situation. So, bone loss is very, very common following tooth loss, and this is physiologic. And we've seen that 20% of the adult population over the age of 40 years tend to have an extremely compromised bone in the posterior region, which could be a challenge when we are thinking about implant rehabilitation. So when you have a scenario like this, wherein you have an excellent quantity and quality of bone, doing implants in this kind of scenario is basically a piece of cake. You can go in and place 6 implants in the maxilla, 6 implants in the mandible. You can restore it without any problems. However, we often come across situations where the maxilla is extremely compromised. Bedrosian has classified the compromised maxilla into 3 zones. You have the anterior zone, the middle zone, and the posterior zone. And this is a classic kind of scenario where we normally come across where you have very, very insignificant amount of bone in the posterior region. The patient had undergone an extraction probably a couple of years back, did not bother about a fixed restoration over there. In fact, he had a partial denture, which has done a huge disservice by him by leading to this kind of severe bone resorption. This is a challenge which all of us come across on a day-to-day basis. So how do we manage it? And what did I do in this? That's where I did a direct sinus lift procedure. We lifted the sinus membrane up, grafted in that area, put 2 implants in the maxilla, 2 in the mandible, and 6 months down the line, we have been able to basically restore it, and the patient has done extraordinarily well. So this is where a sinus lift procedure is something which is an arrow in your quiver, which you can basically have in your entire gambit of implant practice and start incorporating maybe sinus lifts into your practice, which can restore these kind of challenging scenarios. Sinus lift procedures are not new. Approximately about 40 years back is when Tatum first introduced this concept, and Peter Boyne and James in California did a lot of work on what's basically the sinus lift procedures which we do today. Nothing much has changed in the last few decades, but I think this is something which you need to be familiar with, and let's look at how I can take you through so that you can incorporate sinus lift procedures in your practice. If we look at the 8 changes which happens, this is something which you need to definitely know, and anatomy is something which you must know. As a developmental thing, the maxillary sinus develops first amongst all the paranasal sinuses. In the 4th week itself, there is a small tubular invagination which comes adjacent to the tooth structure. The tooth itself is very big, the eye is very big, the maxilla is extremely small, but at the 4th week itself is the first kind of formation of the maxillary sinus. You can see the position of the sinus, which is just a small tubular area next to the turbinate. Now, if we look at how the sinus develops, in the initial stage, it's basically tubular at birth. This becomes more or less ovoid as we grow in the childhood, and it becomes a pyramidal shape in the adult. That is how basically a maxillary sinus develops. And in this cartoon, you can see the way in which the sinus has altered its dimension from a tube into an ovoid shape and ultimately becoming a pyramidal structure. And that's the skull showing how you have the oral cavity, which is extremely close to the orbit, and that's why it's called as a childlike face, where the vertical dimension is very much shortened. There is no sinus, and that's the reason why the mandible and the maxilla is extremely close to the orbit. The cranial cavity takes probably about 2/3 of the face, while the facial structure is very, very much compromised. This is how a pyramidal appearance of the sinus is. You can see the pyramid, the Egyptian pyramids we know is vertical this way. The sinus pyramid is actually like a sleeping pyramid. So you have the base of the pyramid, which happens to be the lateral wall of the nose, while the apex of the pyramid is in the zygoma. The floor of the pyramid is basically the alveolar process, while the roof of the maxillary sinus is basically the floor of the orbit. The antral wall, which forms the floor, is essentially the key thing for us when we are looking at a sinus lift procedure. Now, many times it's extremely thin, and in my experience, I've seen many times it's less than a millimeter. That is the kind of compromise situation which we have, and that's a challenge. Now, in the floor, you have many times the septa, and these septas are incidentally because of the fact that the tooth development, the molar teeth, and in fact, many times even the premolar teeth develop at different times, and because of that, you have these multiple septa in the floor. You also need to be very much familiar with the arterial and the nerve supply to the sinus. The maxillary sinus is very, very vascular many a times. That's because it has got multiple sources from which it gets its blood supply. The posterior superior alveolar artery, which is a branch of the maxillary artery, and the infraorbital artery, the middle and the anterior superior alveolar artery, they all anastomose, and that's where the maxillary sinus is extremely vascular. And sometimes when you're doing a sinus lift procedure, you can get torrential amount of bleeding. The lining is very, very characteristic. It's called as the Schneiderian membrane. Now, this is a pseudo-stratified columnar ciliated epithelium. Now, it's absolutely important that we basically maintain the integrity of the lining, because that is absolutely important for us in drainage. Now, the drainage of the maxillary sinus is important, and it's important that you understand that the ostium, or the opening of the maxillary sinus, is actually almost at the inner canthus of the eye, just below the inner canthus of the eye, while the floor of the sinus is basically at the nasal level. This is the LR level. So basically the drainage happens anti-gravity. Now, the continuum of the lining is very, very important, because this lining has cilia. Each cell can have anywhere between 200 to 300 cilia, and all these cilia work in sync. The drainage happens because the cilia move the droplets of the secretions of the mucus, and ultimately it pushes into the ostium, and then it is thrown out into the postnasal space. Now, one of the other things which is also helpful for drainage is breathing. Now, if we look at Bernoulli's principle, because of the fact that we pull in air through the nasal cavity and exhale it out, there is a negative pressure which is created, and that creates a Venturi effect, and that basically helps also in drainage of the maxillary sinus. So it's very, very important that this balloon of Schneiderian membrane is kept intact. If you damage this, essentially what tends to happen is there is fluid accumulation in the sinus. If the regeneration of the lining does not happen, then you end up many a times with chronic sinusitis. So the whole crux of our sinus lift procedure, whether it's direct or indirect, which I'm going to come to you in a minute, is essentially maintaining the integrity of the lining. So how do we basically go about to assess how much of bone is there in the posterior region? Radiographs is extremely valuable after your clinical examination. And what are the radiographs which we can use? You can use a simple intraoral X-ray wherein you can identify where the sinus is, how the septa is, but it is not extremely useful when you are doing your sinus lift. A panoramic X-ray is definitely useful. That can show some cloudiness. That indicates that there could be a chronic sinusitis, or if there is any pathology or roots which are going through the sinus. That's something which you can study very well with a panoramic X-ray. The what is PNS view? This is the occipitomental view, will indicate whether the sinuses are shown. All the paranasal sinuses are seen, but the maxillary sinus is very well depicted in your PNS view, but it is not extremely useful for your planning. It just gives you some information whether there is any chronic sinusitis or any pathology in the sinus. The gold standard for us to assess the maxillary sinus today is a CT scan. A conventional CT scan gives us very good information. You need to use an axial section, which is a horizontal section, and a coronal section, which gives us very good information in 2 dimensions, and that is where it's extremely useful for our planning purpose. And that's where you can see the beautiful coronal section of the PNS, which indicates the floor, the medial wall, that's the base of the pyramid, the lateral wall, as well as the apex of the sinus, and it gives us an indication about the thickness of the alveolar bone. So all these calculations can be done. DentaScan and CBCT, these are the next generation, and today we are all very familiar and we are using this. So instead of using your conventional CT where you are exposing the patients for more amount of radiation, CBCT is much more effective in terms of giving us a lot more information. But the detail, especially for pathology, is better in a conventional CT than a CBCT. So that's where you need to take which is better according to the scenario. And in my experience, start off with a CBCT. I think that is good enough for a routine maxillary sinus lift procedures. But if you're dealing with maxillofacial pathology, then a regular CT scan is much more useful for us. And that's where you can see a CBCT, where you can see the amount of bone which is available, the volume in terms of height, in terms of width, can be very predictably assessed in this kind of scenario using a CBCT. And that's extremely useful for us in planning of the scenario. Post-operatively also, you can see after doing a sinus lift, where we have placed an implant and a bone graft which has been placed on top of that, and this is very useful for us for our long-term assessment. So a CBCT is probably the gold standard. And this is an anatomical specimen where you can see on your right, wherein you're seeing the hyperinvagination of the maxillary sinus compared to the normal side, and the amount of bone which has been eroded is something which is very important. So you need to understand that the posterior region in the maxilla, the bone is determined by 2 factors. One is the alveolar resorption, and the other is the hyperinvagination of the maxillary sinus. And that is why you tend to lose more and more of bone. This is a beautiful X-ray which depicts how you lose bone following extraction. And if you don't restore it very rapidly, you will lose a lot of posterior bone. And that's the reason why it's important that you place your implants as early as possible. Probably at the time of extraction itself, you can do it. Otherwise, you may have to do an indirect or a direct sinus lift. What are the contraindications for sinus lifts? Absolute contraindication for sinus lift is an active sinusitis infection. This is something which you should never do. If you have infection in the sinus, the patient has running nose, he has got stuffiness, and he has got headaches, he has got pain in the anterior region below the orbit, then it's important that you get a further investigation done. If there is cloudiness in the sinus, please avoid doing a sinus lift procedure. Recurrent history of chronic sinusitis also would be probably a contraindication, because you are invading into the sinus and you can lead to a bigger problem. Uncontrolled diabetics, neoplasms or pathologies in the sinus is also an absolute contraindication. And there are a host of other relatively contraindications. It could be patients who have had radiation. You would consider, or you need to have more experience to basically go in and doing implants in a compromised posterior maxilla. So that's something which you need to basically be prepared for. So how do we do this maxillary sinus lift? And what are the various methods by which you can do? There are three basic techniques. The first one is the indirect sinus lift, wherein we do it directly from the osteotomy which you have created. The second is the lateral approach. That is basically the direct sinus lift. It's nothing but the Cardinal loop procedure which we are familiar, and that is the way in which we approach the sinus from the anterior lateral wall. And today, people have explored the possibility of doing endoscopic sinus lift. So you put a scope through the nasal cavity, go in very carefully, you go in, lift the floor up using tents. It is quite cumbersome, and many times you might disrupt the sinus lining and you might end up with a bigger problem. And that's why endoscopic sinus lifts at this point of time is still not very, very popular across the globe. So let us look into how we do each of these techniques. As I told you earlier, the indirect sinus lift is approached from the oral cavity through the osteotomy which you have created, placement of the implants. So this is a simple technique which I think every dental practitioner can very, very easily incorporate into their practices. Now, most of the times you come across situations where you have bone of about 6 or 8 millimeters in the posterior region, and you want to probably select an implant which is about 10 millimeters. So that is where you can start off with your drilling sequence, and let me take you through how we do that. This is how we are all familiar with how we start with your initial round burr or the lancetating drill. You're just making a point on the surface of the bone, determining the anterior lateral and buccolingual positioning. If that is okay, then you go with your pilot drill. Now, with the pilot drill, you do not go all the way to engage the floor of the sinus. You basically stop short of the sinus floor by about 1 millimeter or 2 millimeters. Ideally 1 millimeter, because then it is easier to knock the floor off. 2 millimeters, you need to really bang with your osteotome and the hammer, and that a lot of patients do not like it. So 1 millimeter is very easy, and that's where precision comes in, and that's where a CT scan is useful for you prior to starting off your indirect sinus lift to assess how much is the height of the bone in that specific region. Let's assume in this kind of scenario, you can see the marking there, that is about 6 millimeters. So the height of the bone is 6 millimeter, and the first marking in your pilot drill is 6 millimeter. So you're exactly short of it by about 1 millimeter, and that's what we have done in this diagram. So sequentially you start increasing, and you're exactly going only up to 5 millimeters with your each progressive drill. Right? So you've completed your osteotomy, or you can undersize the osteotomy. Posterior region of the maxilla, many a times you have soft bone. It's usually D3 or D4. Very, very rarely you get D2 type of bone in the posterior region of the maxilla. So clinically what I tend to do is I undersize my osteotomy by 1 or 2 so that I can use my osteotome. These are the Summers osteotome. Different sizes are there. You have graduations over there. You can know exactly. So you can not only knock the floor up, but also you can do what's called as lateral condensation of the osteotomy. So thereby you get good primary stability. So that's something which you can definitely do. So these are different instruments which you have. You have different sizes of osteotomes which can be fixed onto a handle, and that's a mallet. And this mallet particularly I like because when you have a silicone kind of attachment to the mallet, you don't get the metal to metal contact, and thereby the patient does not feel. You see, you need to understand that the maxillary sinus is an empty cavity. It's like keeping a speaker inside a drum. You get more of the vibrations, and that's why many of the patients say, oh, my whole head is shaking when you bang and use an osteotome. So that can be suppressed by using this kind of osteotome, just that you don't get metal to metal contact and the vibrations have been lessened. So you use your osteotome and gently knock the floor off, very, very gently. You don't have to bang. A very gentle hit with the mallet onto your osteotome generally knocks the floor off. So what we are looking at is a simple balloon when you take, and if you use a pin, you will burst the balloon, right? And that is exactly what you will do with your pilot drill. Instead, we basically take a balloon and punch with your fist, you will never be able to burst. And that's what we do in an indirect sinus lift. So we're using an osteotome to basically leave a punch to the entire floor, so the whole floor gets elevated. So there is a crack which gets propagated all around, and that Schneiderian membrane, the balloon of the Schneiderian membrane which is there, gently gets elevated. So that's the whole way in which we can do. Once we have done that, then you can use bone graft over there, you can pack it in. Basically, you can use your osteotome to push the graft, which gently goes in and settles below the Schneiderian membrane, and thereby you've elevated the Schneiderian membrane up, and also you've increased the height of the bone very, very easily. So let's see a case where we have this. I did probably almost about 20 years back on this patient. That's the osteotome which is used. In the anterior region, we have not basically placed any, we've just used a 10 millimeter in good bone. But in the posterior region, you can see how we have entered into the sinus. It was about 7 millimeters. I've just elevated using an osteotome, not used any graft over here. And you can see in about a year's time, the way in which the bone naturally has formed around the implant, and we have got 10 millimeters of height. So we've regenerated about 3 millimeters of bone by doing the simple procedure of an indirect sinus lift. Not every time you need to use bone grafts, but there are times when you have less bone, you can use the bone graft and you can basically lift the sinus membrane up and get good amount of height of bone in the posterior region. So let us now look into how we do the next procedure. That's essentially the direct sinus lift. Direct sinus lift is, as I told you earlier, is like the Caldwell loop procedure. You create a window in the anterior lateral wall. That's basically you raise a flap, elevate the mucoperiosteum completely from the anterior lateral wall, go all the way up to the orbital floor. So that's important. You need to identify where the infraorbital vessels and nerve is. The canal comes there. You can go up to there, but please do not damage it. It's a robust kind of neurovascular bundle. But if you are bad in instrumentation, you might even injure there, and then you can get a bit of numbness in the cheek, in the lateral aspect of the nose, as well as the upper lip. That's the distribution of the infraorbital nerve. I've never had anybody, in any of our cases, coming back and saying that they've had numbness in this area. So essentially, you are basically lifting the floor, the sinus wall, through a lateral approach, where you create a window in the lateral aspect, and you have special elevators, and these are important for you to invest because of the curvature. You need to go down and gently lift, and these sinus elevators are absolutely invaluable in gently teasing the membrane out of the floor of the sinus. So it's extremely useful, and you can see the window here which has been created. The bone has been pushed inside and the sinus lining is lifted up, right? Now the sinus lining is a tricky lining. In very healthy individuals, it's extremely thin. In my experience, I've seen chronic smokers have very, very thick lining. So it's a piece of cake to lift the lining in a chronic sinusitis or chronic smoker, I would say. subclinical infection would have caused a reaction and the lining becomes very, very thin. So many a times you can get perforations, and that's something which you need to be extremely careful of. So let me take you through how we do this. This is an incision where we have basically made a crestal incision with an anterior relieving incision. The mucoperiosteal flap has been raised, and this is the drilling sequence which we are doing over there, where you can see a lateral window. I personally tend to use a drill. You can use even a piezo surgery. You can have special instruments today which will basically help you in creating a window over there. Piezo surgery is extremely useful because of the fact that it doesn't damage the lining. So when you cut, piezo surgery is nothing but cutting with ultrasonic frequency. It's a very, very slow process with which you do that, and you don't damage the soft tissue when you use an ultrasonic instrument. That's the whole advantage of using piezo surgery. But it's painfully slow, and for a surgeon it becomes you become very, very impatient, and that's why I personally like to use a drill whenever I do a sinus lift. And that's a window which we have created there. You can see the bluish lining there. That's the sinus membrane. So the next step would be to use your sinus elevators. These are like fine periosteal elevators. It's like almost like a curette, but very blunt. So you go in and engage the flow. Very, very important that you're very close to the bone so that the lining is very, very gently lifted. And if you have septic, then it is important that you use an antral balloon. This is a very, very useful technique. It's an additional cost which you may have to incorporate when you are, talking to your patients, but it is an extremely useful tool for you to basically lift the entire flora, right? The entire Schneiderian membrane can be lifted up from the floor, and especially if you are doing a large area. In this case, we are restoring 6, 7, 8 in the area, so that's where we are basically placing 3 implants which we had planned. And to overcome the septum, an antral balloon is very, very useful. So you squirt in some saline once you have gone inside, so you can see the antral balloon being placed there, and when you inflate the balloon with saline, the lining automatically lifts up, and there you can see the entire lining which has been lifted up. That's the pre-op X-ray. Very interestingly, you can see the septum over there, which is right in the middle, and you can either use a balloon, or if you don't have a balloon, one of the things which you need to do is you need to create 2 windows, and the first one can be in the first molar area, and the second one can be beyond the septum, that's in the second molar area, and that's how basically you can atraumatically completely lift the balloon over there. This is the post-op X-ray which you are seeing over here. And this is where we have placed 3 implants over here. And you might ask at this point of time, should we do only 2 implants over there or 3 implants? Now, I personally like to put more implants when you have compromised bone. That is because you are having a better load distribution, and the longevity of your implants and your bridge is going to be much, much better. And again, in this post-op X-ray, you can see the amount of bone which we have put in there. It's not just up to the 10 millimeter at the apical area of the implant, but you need to go another few millimeters, 4 to 5 millimeters beyond, so that you can allow for the resorption of the bone to happen. And when you see the post-op X-ray with the bridges or crowns in place, you can see the kind of final settling of the bone in the sinus graft area. Another very challenging case which you're seeing over here, this is another case where the bridge failed, and this gentleman had to get his first molar removed, and you can see that the bone in the first molar area is very, very minimal. In fact, the CT scan showed that it was only 0.5 millimeters. So it was an extreme challenge for us to basically rehabilitate the patient. So what did we do here? We did a direct sinus lift for the first molar area, and the area where we extracted, immediately we went in and placed an implant. This is because nothing like your native bone. When you have a socket, place implants directly in. Now, adjacent to the area in the first molar area, you can see the amount of bone which we have put in there. This is a 10 millimeter implant, and we have actually increased the height there by about 15 millimeters. Again, giving room for the amount of bone resorption which can happen. I've used bone scraper here. You can basically harness bone scrapings from the cortical bone. You can use it either in the posterior ramus of the mandible, the buccal shelf area, and also in the symphysis area. This is an area where you can just scrape the bone. You get cortical flakes of bone like this here, and it is extremely useful. Just putting this bone graft into the area there may not help because the resorption will be very, very significant. So what I tend to do is I use a combination, and the combination is autogenous bone, be it cortical or cancellous. Cortical would be bone chips like this. Cancellous would be the marrow area, which you can get it from the symphysis, and you mix it with the synthetic graft material. It could be any synthetic, it's your personal choice what synthetic graft material you put in. This acts as a filler and delays the resorption process. In addition to that, we normally use platelet-rich fibrin or platelet-rich plasma. So you mix all these things together, and this combination gives the best ecosystem for you to form new bone in the maxillary sinus. And that's where you can see in the post-op X-ray the kind of graft which we have increased by about 15 millimeters. Now, 6 months down the line, the bone has consolidated, resorption has happened, and you can see a new implant which has been placed in the first molar region. And that's the bridge which we have placed in. And this patient has had his implant and the bridge for more than 15 years now. So doing these kind of cases where it's extremely challenging, from 0.1 millimeters, we have at least been able to place a 10 millimeter height of implant using a direct sinus lift. Now you might ask me, oh, sinus lift requires a lot of training. Yes, you need to be trained, but are there simpler methods by which most of the clinicians should be able to do a direct sinus lift? Indirect sinus lift is a piece of cake. It's not a big deal at all. You come over, undergo a training, maybe just a weekend program, you practice on the models, you do it on the animal heads, you do it on the cadaver, then you directly go off. When you're talking about a direct sinus lift, it needs a bit more of surgical skills. A maxillofacial surgeon would do it very easily because that's his job, day and night. But for a regular implantologist, you have today certain tools which will help you in incorporating a direct sinus lift in your day-to-day clinical practice. So let me share with you how we can do it. Another very interesting case, you can see the height of the bone here is only about 4 millimeters. This is a young patient. In fact, is undergoing orthodontic treatment. And you can see in the first molar area, following the tooth extraction not being replaced, the bone has resorbed very significantly. There is only 4 millimeters and the gaps are significant. So that is where we are doing a direct sinus lift. The regular raising of the flap, you can see the anterior lateral wall of the maxillary sinus raised over there. And here you are using a specific tool, and this is a reamer, which a surgical reamer, not the endodontic reamer. This one is extremely useful with a guide and a reamer. You can basically create a window without rupturing the sinus lining, right? So this is the same thing when, as maxillofacial surgeons, when we are doing craniofacial surgery, when we work very closely with the neurosurgeons, we have seen when you do craniotomy, they also use similar burrs which will not damage the dura. So you're able to do the window in the bone without damaging the dura. So these are the devices which you have. It's a small kit. It's essentially a guide and a reamer which is there. Again, you can practice this and we train you in the courses. Very simply, you can use this. See the sinus lining going up and down. This is basically when you ask the patient to breathe or do a Valsalva maneuver, the sinus floor gets lifted up. That indicates that your entire balloon is intact. The Schneiderian membrane is intact. Once you've lifted the membrane, then you can place your graft in, and that's where we have actually placed the graft over here. You can put a membrane also, you do the suturing, and you can see in the post-op phase. This was a study which we did. One of my postgraduates took up the study to see the long-term efficacy of the bone graft in both direct and sinus lifts. And you can see that from 4 millimeters, we increased the height to about 13 millimeters. And then after about 6 months, you can place your implants in. So what are the complications which you can get following sinus lift? There are a number of complications, but probably one of the most common complication would be a sinus membrane tear. Now, the tear happens when the lining is extremely thin. Now, healthy individuals generally have a thinner lining compared to a smoker, for example, where because of this chronic sinusitis which they would have had over a period of time, the lining becomes extremely thin. Now, if the perforation is a very small perforation, then probably you do not have to do anything. If you just raise the membrane, that itself, basically because of the laxity of the membrane, it might seal by itself. But if it's a moderate kind of perforation, in such cases, we may have to basically think in terms of putting either a PRF or you can put a membrane into. A collagen membrane would probably be very, very useful. If it's a very large tear, now this is where it's a challenge. This is where it's difficult to contain the graft material which you are going to place into the implant. You can, of course, put a membrane in, and there is a pouch technique also which has been reported in the literature, but I'm concerned about using these techniques because the long-term success may not be very, very good. You might end up with acute or chronic sinusitis when the graft material migrates into the sinus and leads to infection. So you can basically fix this membrane. It could be either a Weichel membrane, it could be a Gore-Tex membrane, or it could be any of the membranes which you can use. This is basically tagged onto the lateral wall of the sinus, and then you push this membrane inwards, which rests below the Schneiderian membrane, and in that pouch you put the graft in, and you can basically see the way in which we have done this here. Again, not a very, very successful technique. Many a times I would recommend, if you have a huge tear, abandon the procedure, wait for a few months, allow the lining to regenerate, and then you can explore doing a sinus lift again. The other complication could be an acute maxillary sinusitis, which is an immediate reaction following a grafting in the sinus. That is because there is some contamination or infection. The patient presents with severe pain, swelling, foul discharge from the nasal and oral cavity. Sometimes pus can be coming out from there. You can get puffiness in the anterior lateral wall of the face, and also you can get edema in the eye. So that is something which is acute sinusitis. Sometimes you can land up with a chronic sinusitis too. So that's in the long term an issue which you need to be concerned about. What are the common post-operative instructions you would like to give to your patient? The most common thing is what is called as the sinus regime instructions. 3 things you need to do when you have a patient when we go into the sinus. The first thing is put the patients on antibiotics. Absolutely important you start the antibiotic a day before. There's no point starting the antibiotic after doing the procedure. It's important that the antibiotics is already in the bloodstream. What is the most common antibiotic? Amoxicillin 500 milligrams TID, or you can also step it up to Augmentin, that's amoxicillin plus clovenic acid, or you can also add metronidazole 400 milligrams TID so that you have less chance of infection. The second most important thing is ask your patients to do steam inhalation. This basically clears the nasal passage. And the third thing in the antral regime is the fact that you put them on nasal drops. It could be a saline nasal drop, it could be ephedrine or otrivin nasal drops which you can use for a few days. This prevents any infection. Please tell your patients to refrain from smoking, otherwise there is always a possibility of rejection. What is the take-home message when you do a sinus lift? When do you basically do a direct sinus lift and when do you do an indirect sinus lift? I mean, there is no general rule or anything like that, but I think a guidance, this is based on my clinical experience. What I've been following is essentially if you have less than 4 millimeters, 1 to 4 millimeters of height of the bone in the posterior region, I would do a direct sinus lift. If it is between 5 to 8 millimeters, then you would do an indirect sinus lift. You might ask me what the success rate with sinus lifts are. Generally, the literature basically says anywhere between 99% to about 50%. I would say probably in the range of about 80 to 90%. This is what most of the literature says. And in our clinical experience also, we have seen around 90% success with sinus lifts. So, how do we now kickstart with sinus lifts in your practice? Absolutely important that you basically train. And the reason why we say training is important is you might have seen that even the best of the best sports players, they do still have a coach, whether it is Nadal or whether it is Steffi Graf or anybody. All of them, even in the past, have had a coach who will be there to guide them. And that's exactly what we have been doing in Implant Study Group. We have coached more than 1,000 practitioners to elevate their standard of dental care, to elevate their implant dentistry to the next level. And that's what we have been doing it for the last 15 to 20 years. Absolutely important that you understand the basic concepts, practice it, and then take it to your patients. And how do you practice? In the training program, we give you demonstrations, then we give you hands-on training, starting off with models, then we take it on the animal heads where you practice. This is on goat heads or on pig heads, basically, where we allow you to do the sinus lifts or any other procedure. It could be bone grafting, it could be nerve lateralization, or it could be sinus lift procedures. All these things, once it is done, then we take you on to the cadaver. These are cadaver training programs which we run in the advanced training program, and you can see how our trainees are actually doing it on the cadavers. And this is a snapshot of our own course where we have trained people to incorporate a maxillary sinus lift, a direct sinus lift. You can see how the window has been created, how the lining is still intact, and how we elevate it and use graft materials so that you learn this. Once you practice in a systematic way, then you are ready to do it on your patients. The outcomes can be much better, the outcomes can be much more predictable, and you tend to have a much better success. And that's a snapshot of the training program which we have done. We have done many such kind of programs on cadavers and extremely successful. Now, what is that we are excited today about? With Implant Study Group, we have really trained more than 1,000 practitioners to take up implantology. And during the COVID time, when the training programs had to be modified, we were looking at, both myself and Dr. Anand were thinking how we can elevate the standard of training and how can we make it more accessible and more predictable in terms of training. And that's when we met Mrs. Anita and Arvind, and we felt that there is a potential to basically go into another dimension. And that's where we were introduced first of all to virtual reality, augmented reality, mixed reality, and also haptics. The very first time I put a gear on, like what you're seeing on this slide, and then we saw the kind of thing, it was so exciting. It's something which I'd never experienced before. As a clinician for more than 32 years, I had never seen anything like that. It's like watching the entire OT in front of you, and you can go into a surgery, you can feel it, you can pick up an instrument, and you can practice with the clinician who is demonstrating, and that's called as imitation learning. Now, imitation learning is like practice, and you can do it many times. You can do it at your home, and that's the biggest advantage of that. And that's a snap which you can see where you can do it at 3D level. This is something which you can feel, and that's where haptics come in. You can pull your CT scan and then you can, basically do the planning. And that's something which is extremely exciting. And let me basically show you a video of how we have basically gone in and done a recording of an implant. This is how you see the entire OT setup. You have the menus where you pick it up. It feels like you're in the operation theater itself. And once you go in, that's where you're experiencing the 3D virtual reality and augmented reality. That's the surgery, what you're seeing in 3D. It feels like you are actually operating, right? So that's virtual reality. The next level is basically where you can do the planning too. So you can pull up a CT scan, and this you can see in air. So you can get the sections, you can do your planning, and once you have done that, then you can practice, and that's where learning becomes very easy, and that's imitation learning. That's where haptics play in, so you can feel the drill, you can do the drilling sequence, you can follow the clinician how he is doing, you can take a knife and you can basically cut, you can use the needle holder and suture, and that makes your training a fantastic opportunity. So that's where I would like to end this program by saying that we are super excited in this new year of 2022. Although we have been through so much in the last 2 years with COVID, we have evolved in the way in which we are training people. And I'm really, really excited that in India, we are able to do this kind of training. In fact, very few centers across the world have actually taken this up. And if you look at it today, there is so much of buzz in the metaverse. Even Facebook has named themselves today as Meta, based on metaverse. Microsoft is going big time. They have actually acquired a huge company on virtual reality and augmented reality for almost $80 billion. And there is so much of happening, and this is going to be the future. And I'm delighted that Implant Study Group is partnering today with Global Dental Academy to bring to you these kind of training programs on virtual reality and augmented reality. A host of programs are going to be now released in every aspect of dentistry, and that's so exciting for us. Thank you very much. I hope you had a good time. Thank you.
Thank you very much, sir, for a very comprehensive and insightful knowledge on sinus lift in day-to-day practice. Thank you for also giving us a beautiful world of virtual reality. I'm sure all our participants are very excited to get into this. One of our participants has asked a question. How often do sinus lifts in the era of all-on-4 and other graftless solutions that we actually do? Can I please ask Dr. Girish Rao to please come on live to answer the question?
Gauri, can you hear me at all?
Yes, sir. The voice is clear.
Yeah. Well, if I look back into my practice, probably about 20 years back, it was completely, different. I mean, we were doing, I would say, sinus lifts probably on a week-on-week basis. Today, we've changed completely. I mean, yes, there are specific indications for sinus lifts, but I think I'm doing more and more of pterygoid implants, doing more and more of all-on-4 implants, and probably zygoma implants. That's because we know that the predictability of success is much, much more when you actually deal with native bone than grafted bone. So that's where I think there has been a shift. And there has been, I think, as practice, we have evolved over a period of time. Significantly, we've evolved, I would say. But yes, sinus lifts definitely has a huge role. And now there are times when even today we'll be doing a lot of sinus lifts. But comparatively, I think we are shifting ourselves into tilted implants. And that's something which is probably we can have another talk at some point of time in the future on how you can start doing tilted implants and do graftless solutions. So that's another chapter by itself. But yes, sinus lift is there for you to use, and it's a very useful technique. It's a very simple technique. And I think every clinical practitioner should be trained, should have this in his armamentarium to use it judiciously. And above everything, I would say case selection is the key for your success. Thank you.
Thank you so much, sir. May I now request Dr. Anand Krishna, consultant prosthodontist and implantologist and founder of Implant Study Group and Global Dental Academy, to please join in live for the conversation. We will be briefing our participants on the information about the courses and introduction to the next webinar. I would like to introduce, it's my privilege to introduce Dr. Anand Krishna to all of you. He is a renowned prosthodontist and implantologist with extensive clinical and teaching experience in implantology and complex restorative procedures. He graduated from Government Dental College, Bangalore, and did his master's from A.B. Shetty Memorial Institute of Dental Sciences, Mangalore. Dr. Anand Krishna is the first board-certified prosthodontist from the Indian Board of Prosthodontics and diplomate of ICOI. He's been in academic teaching and has served various institutions. He has also occupied various designations at several national and international organizations. He is also the secretary of the Karnataka Prosthodontic Society, scientific coordinator of the ICOI in South Asia, and an executive council member of IPS. He is the founder of My Dental Plan Healthcare, 3Dent DTS, an implant study group in Global Dental Academy. He is trained extensively in the field of crown and bridge implantology and has vast experience in implant prosthodontics involving different implant systems. Dr. Anand sir and Dr. Girish sir will combinedly answer any questions that the participants have at this point of time. Can I please request them to come on live so that the questions can be posed? Thank you very much, sir.
Hi, Dr. Gauri. Yes, I was listening to the previous question of whether you would want to do grafted or graftless kind of solution. I think one major hindrance that we will have to do graftless solutions is in partially edentate situations. When you have a single missing tooth, or when you have a situation where, like Dr. Girish was mentioning, the Bedrosian classification, where you have almost no bone in the premolar region. So if you have at least about 4 millimeters or 5 millimeters of bone, we could think of a sinus layer. But if it is just a millimeter or two or things like that, when you are in very, very compromised situation, the only two solutions that you have is, one is to do zygomatic implants or to do extensive sinus lifts. Okay, extensive sinus lifts, by which I mean, yeah, it is going to be a direct sinus lift. It is going to be a two-stage procedure. And those are situations which you cannot avoid doing a sinus lift. Yeah. So yeah, that's basically the answer. If it's a full mouth case and if there is some bone, then it's still all right to do tilted. But when you're dealing with a partially edentate situation or a single tooth missing kind of situation with a very compromised sinus floor level, then you will have to do sinus lifts. Yeah.
Thank you very much, sir. We are just taking any questions from the participants, if there are any. Meanwhile, if you could please kindly brief us about the courses that are upcoming in the Global Dental Academy, as well as how we are trying to bring in the virtual reality experience that we have, so the participants will get a good view about it.
Sure. So when we started Implant Study Group way back in 2004, both Dr. Girish and myself, our main focus was implant dentistry and how we can train people to take it up into their own practices. This was the only motto that we had. And we have been pretty successful in that way, in the sense that we have brought in multiple systems. This was not a system-based kind of course. It was a science-based kind of course. So we have managed to try and educate people about multiple systems. And we used to use practical as the basis for simulation, in the sense dummy models and dummy jaws as a means of simulation. But we also understand the limitation of this physical kind of simulation models. There are some situations which you cannot simulate, in the sense we could not probably teach a sinus lift procedure in the earlier stages. Of course, the sinus models came in much later. In 2012, 2013, we started having sinus models. Either we shifted to animal models, or we were left with the kind of explaining it to them with some videos and things like that. Today, there is a huge opportunity for us with India being in the forefront of so much of innovation in the technology side, we want to adopt this technology to simulate each and every kind of situation in which the participant can go in, and he can actually do some imitation learning, some kind of a haptic feedback can be given, and he can learn certain things before he actually goes ahead and does it on patients. So we want patient safety to be at the highest level. See, whenever we do complex procedures, we always know that there is some amount of upskilling required for any surgical specialist. Even if as the most experienced surgical specialist, when you're doing a certain new procedure, there is always a chance of some kind of collateral damage which can be there. We are trying to minimize this. We are trying to make concepts very clear by using technology, and we are trying to have a simulated environment for each and every situation. That is what is the biggest take home from the virtual reality and augmented reality kind of situation simulators. So our main focus was always implant dentistry. We still have the same kind of programs like the foundation program, the fellowship program, and the advanced implantology programs, the 3 levels of programs that we always had with implant study group. The same thing we bring on to Global Dental Academy. Of course, now the major shift would be that you would not want to spend so much time in the premises of the lecture and things like that. Earlier, we fellowship program used to be for 12 days. Now, most of these lectures will be taken online. There will be practical sessions and the clinical sessions which the participant has to kind of attend. So the number of days that you will have to travel for actually completing your skill enhancement is much lesser than what it was earlier. That's one big change. The second big change is, of course, the introduction of virtual reality and augmented reality tools for you to enhance your learning. So the clinicals will be almost the same. The practicals will be both VR based and also practical based. That is simulated models and also physical models. And of course, the lectures will be totally online. And of course, we will have a lot of interaction online throughout the course itself. That is the implantology programs. Other than that, now our focus is to incorporate certain new practices, something like digital dentistry, which is again in the very, very budding stages now. We want to bring in kind of a calibrated curriculum into this whole thing, and we want to make sure there are some ground set for standardizing some of these platforms and actually going ahead and doing some digital dentistry learning also. Yes, this is another big focus that we have. Other than this, we have infection control in dentistry, which we all know is very important due to all this pandemic and the COVID wave and all that. It is going to be there for some time. The medical emergencies in a dental practice and management of medically compromised patients. Now you have patients with so many multiple medical issues, which we are trying to deal with in the dental office. So that's another thing that we want to bring in. We want to bring in orofacial pain and airway management. We want to bring in single sitting root canals, rotary endodontics, smile designing. Multiple such programs have already been planned. By the end of the year, I think we are looking at something like 100 different courses to be on the GDA platform, so that we have more to offer to all our participants. So that's the whole idea and the gist of what GDA and what the vision of GDA would be. Now, coming to the next webinar, sorry, Gauri, I think you wanted to ask something.
No, sir, please carry on. We have a few questions. I think we will take it up after you finish.
Just a couple of minutes. So the next webinar, I'm trying to do something on implant abutments, because this is now that I also run a laboratory, a digital laboratory. So I know what everyday challenges are for clinicians. They want to understand how to choose an abutment and what are the different types of abutments, whether this collar height is all right or not, or whether this is the emergence profile that he has to get or not. When to customize an abutment, if it is an overdenture, what type of overdenture abutment to choose and when to choose, and many questions like this is what is there in the clinician's mind. And more we speak about this, I think there will be more clarity for many of our participants. Many of them who are non-prosthodontists also will greatly benefit, because sometimes they just depend only on the technician to give them directions, and many of these technicians are also half-cooked, to say the best. But yeah, there has to be science behind some of these things. That's what we are trying to explore in the next webinar. I think it'll be a month from now. We will make that announcement shortly. Deciphering implant abutments is the topic which is going to be there.
Excellent. Thank you so much, sir. I'm sure all our participants all over the country and world hopefully are looking forward to such very engaging webinars, as well as the courses that we are coming up in Global Dental Academy. So few questions which have come up for the sinus lift lecture. I would like to pose it to both Dr. Girish and Dr. Anand regarding this. So one of our participants has asked, who is qualified to do a sinus lift? As a general dentist, can one perform all the procedures that I will need, or I need a surgeon on board for them to perform the sinus lift?
Sorry. Brilliant question. Always, this is a controversy which comes up whenever implantology has, looked upon. Who does implants itself is a big thing, whether it's a surgeon, a periodontist, or a prosthodontist. I think, in my opinion, all of us should be doing. Implantology should be done by a general dental practitioner. But when it comes down to much more challenging kind of scenarios, when it's in the surgical front, then I think it's the surgeon. Probably he has a much vast experience, and that he can bring to the table. When it comes down to full arch rehabilitations, a prosthodontist has a much bigger experience, and he brings the thing into the table. And when it's in guided bone regeneration, a periodontist probably is the best person to come in. But having said that, you see, in anything and everything in implantology is something which is, you're bringing, these three specialities together. And a general practitioner, if he can upgrade himself and learn these techniques, that is the key. I don't think, I'm talking about when I was training. I mean, this, of course, is about 33 years back. At that point of time, implantology was just one word in our textbook of maxillofacial surgery. We had never, even thought about lingo. It was something which we had heard, and Brennemark was somewhere, some guy is there by name Brennemark. But it's only in the last kind of 20 years, things have suddenly boomed. We have, completely changed. There has been a paradigm shift in the way in which dentistry itself is practiced. We have embraced technology. And today, to see way in which when a new thing like, virtual reality, augmented reality is being introduced anywhere in the world, we are already thinking about 20,000 participants we want to have by end of this year. That is the leadership role what India is taking today. And that is something which each dental practitioner should upgrade himself. And that's what I believe in. There is a potential in you. As long as you train yourself, you do a good job, then there is nothing wrong, and nobody can stop you in terms of saying, hey, I'm doing an excellent, sinus lift. I know a prosthodontist in Vijayawada. He's a good friend of mine. This guy is so passionate about doing surgery today. And I feel proud when he keeps sending he did our training program. In fact, he came and did our basic, fellowship program. Then he came for our advanced surgical program, advanced prosthetic program, came back again for the cadaver lab. Twice he did it, just because he wanted to improve himself. And today he does almost on a week-on-week basis, bone grafting, sinus lifts, and everything. And I feel so proud that he has taken his practice to the next level. So everything depends on you. How much you put in, how much you learn, and then you can take your practice to the next level. Yes, of course, if there are challenging cases, if there are very complicated cases, call a specialist. Nothing wrong in that. I mean, even as a maxillofacial surgeon, when I feel that, hey, I'm not good at nose jobs, rhinoplasty, I call a friend of mine or refer my patient to him. Doesn't mean to say that I'm an incompetent maxillofacial surgeon. So know your strengths, know your weaknesses, and give the best to your patients. That's what I believe in.
Thank you so much, sir. Just an add-on question to this. was any additional prosthodontic considerations required for sinus lift procedures when we do implants?
Absolutely. I mean, everything in implantology is basically dependent on the prosthodontist. I mean, that is the key. People should know that an implant is a prescription given by a prosthodontist. Finally, remember that everything begins with end in mind. And I'm sure that is where myself and Dr. Anand, we have partnered ourselves together. And for nearly around, more than 2 decades, we have been practicing together. And that's where we give such good results. It's just because we think alike and we know where we need to get the final prosthesis. So you might be a superb surgeon, but if you put it in the wrong place, it's of no use at all. So absolutely. So everything depends on prosthodontics. So Anand, if you would like to add something.
Yeah, just a quick thing on the previous question, whether you need to be a surgeon to do a sinus lift. The Edmund Bedrosian classification that we were mentioning regarding maxilla, and he's supposed to be one of the go-to persons for zygomatic implants, and he happens to be a prosthodontist. And, as a prosthodontist, it's almost impossible for me to imagine myself doing a zygomatic implant because the learning curve will be so huge. But this guy, way back in 2008, even when we visited him, he was the guy who was training us for zygomatic implants, and we happened to do the first zygoma case in India. I remember that we had such a tough time during those days trying to understand this. Yeah. With regards to your question regarding, is there any prosthodontic consideration with regards to implant in a sinus lift case? Whichever case it is in implant industry, if you want long-term success with the restoration, there has to be a lot of prosthodontic consideration. Just to give you an example, the timing of loading itself is something which you will think about quite a bit before you start loading the case. The number of implants that you would want to place. Say, for example, if it is a single molar missing, then you might think of just a single implant if the bone is good. But if you're doing an extensive sinus lift, then you might think of 2 implants instead of 1. So that's another thing that you will think of. The kind of occlusion that you would want to give, the width of the occlusal table, which is going to be there, the contact points, whether it is going to get fused crowns or it is going to be individual crowns. Many considerations like this will depend on what kind of bone density that you're looking at. So this is also called as density-driven treatment planning. It's not that all implants are of the same strength in terms of the integration, in terms of the bone around and things like that. So you always have to think of how the load-bearing capacity of this bone is before you actually consider a long-term loading solution to this. So yes, it involves a lot of planning, a lot of strategy, a lot of thinking before you actually do an extensive sinus lift case. So there are a lot of prosthetic considerations that you should think of, starting from positioning the implant to timing of loading, number of implants, the type of implant that you're going to place, and multiple such things. Yeah.
Sure. Thank you so much, sir. There's another question I would like to take, which says, what is your take on sinus lifts done along with osseo-densification techniques?
Yeah, I mean, osseo-densification technique is, yes, a good technique. Essentially, in the native bone which you have, you're basically using your drilling kind of technique itself so that as you're going along, basically you're compressing the bone. And in fact, a lot of companies are changing their drills itself to bring in a standard osseo-densification technique. So I think the goal should be to get good primary stability. And whatever you're trying to do, if it can help, then definitely go for it. And that's where either use these special drills or basically use these osteotomes, which also does, a bit of lateral condensation. So you get good primary stability. Definitely go for it.
Okay, excellent. One more question is that can we use surgical guides, as in the drill specific guides, so for implant the sinus lift procedures?
I think you should be using that. I mean, it makes your life so much easier. and it is in a progressive way. So I think definitely you should always use this too.
Great. Thank you so much, sir. I would ask the participants if there are any more questions. Otherwise, we will be going on to the next segment. Thank you so much, Girish Rao sir, and thank you so much, Dr. Anand Krishna sir, for giving us a very comprehensive knowledge and insight about the surgical as well as prosthodontic aspects of sinus lifts. We are looking forward to the next webinar session on the abutments as well, and I hope all the participants are delighted after this session. We would now be proceeding towards the next section of the webinar. I would now request Dr. Meghana Maruti to come over live and render the vote of thanks. Dr. Meghana works as an oral and maxillofacial physician and radiologist at Yashasvi Dental Clinic in HCG Enterprises Limited, Bangalore. She is a skilled MBS graduate specialized in oral medicine and maxillofacial radiology from JSS Academy of Higher Education and Research, Mysuru. Dr. Meghana is proficient in diagnosis of diseases pertaining to the jaws, oral cavity, salivary glands, and medical management of the same. Her specialty holds her in good terms of dental potentially malignant disorders caused by the use of tobacco. She is passionate about the orodental management of cancer patients and has contributed to compiling for the Dental Rehabilitative Oncology course curriculum at HCG, which is a part of Global Healthcare Academy. She has been the faculty at Tobacco Cessation Workshop conducted at HCG in 2019. She is an active member of the National Cancer Grid ECHO program, representing the Dental Rehabilitative Oncology team from HCG. She has compiled and executed webinar series in augmenting swallowing with prosthodontics, along with the Society for Feeding and Swallowing Disorders in June 2021. Over to you, ma'am, for the vote of thanks.
Thank you, Dr. Gauri, for that introduction. The education process, which started off with blackboard learning and then it went on to audiovisual learning, and then now to the next level learning, which is, virtual reality and augmented reality. Wow, we have actually come a really long way, and it's extremely interesting. I mean, today's webinar series was amazing for all of us. I'm definitely awestruck. Firstly, I would like to thank our delegates for taking their time off and attending the webinar series. I would like to thank our associates, My Dental Plan, Trident DDS, Implant Study Group, IDA Bangalore Branch, South Asian Society for Oral and Maxillofacial Implantology, and also 8 Chilies for associating with us. I would like to extend my gratitude to our visionary team, which comprises of Dr. Ajay Kumar, the chairman, Mrs. Anita Niranjan, the managing director of GHA, Dr. Girish Rao and Dr. Anand Krishna are visionaries and leaders in the dental fraternity and heading the Global Dental Academy. Of course, I would like to extend my special thanks to Mr. Arvind from 8 Chilies, who gave us an awestruck presentation about what they are doing at 8 Chilies and how they're so much into AI, virtual reality, and augmented reality. Thank you, Dr. Gauri, for your pleasant moderating skills and helping us host this program. And last but not the least, this program wouldn't have been so successful without the backend team at GHA and GDA, for structuring and organizing this program so smoothly. Thank you all. Hope you've had a pleasant Sunday morning with an enriching learning experience. I did, so I hope all of you did. Thank you for joining in. I hope all of you participate with us in the near future in the coming webinar series, and also the program that is laid down at GDA. You can all log on to the GDA website and look at the various programs that are coming up, and you can enroll in them too. And you can always contact us at GHA and GDA to know more about the program, and we will be happy to help. Thank you.
Thank you. Thank you, Meghana.
Thank you so much, Dr. Meghana Maruti, for the vote of thanks. I hope you all had a wonderful and insightful session today. I personally thank and sincerely thank Dr. Ajay Kumar sir, Dr. Girish Rao sir, Dr. Anand Krishna sir and Mrs. Anita Niranjan ma'am for giving me this wonderful opportunity to moderate the first webinar series of the Next Level Learning from the Global Dental Academy. Education is the passport to the future, for tomorrow belongs to those who prepare for it today. This is me, Dr. Sri Gauri, signing off. We will be back with more exciting content on the Global Dental Academy platform for all of you. Please log in to globaldentalacademy.org for more information. Have a wonderful day. Thank you one and all.